Good afternoon. My name is Robyn Grant, and I'm the Director of Public Policy and Advocacy at the National Consumer Voice for Quality Long-Term Care, Consumer Voice for short. We advocate for quality care, quality of life, and the rights of nursing home residents and other long-term care consumers. Consumer Voice strongly supports the Essential Caregivers Act because it would ensure that nursing home residents are never again left completely without crucial assistance and support from visitors during a public health emergency. Access by essential caregivers to residents during a public health emergency is truly essential because we now know that banning all visitors or severely restricting visitation can be as dangerous as the spread of the disease the ban is seeking to prevent. When visitation is shut down or significantly curtailed, residents experience harm from social isolation. Residents are deprived of critical help from family in meeting their needs, and poor care or even lack of care goes unchecked. To look at the impact of isolation, lack of family support and assistance, and poor care on residents, Consumer Voice conducted 2 surveys of family members and published the results in 2 reports, the first in January 2021 and the second just released today. We found that shutting down visitation had a devastating effect on residents. In the January 2021 report, families indicated their loved ones had substantially declined, both physically and in terms of their physical appearance. Families also observed a substantial decline in mental status. Approximately 6 months later, the report from June 2021 showed that even though CMS had eased visitation restrictions, little had changed. I want to share some of the comments and information provided by family members in these survey responses. In terms of physical decline and appearance, families told us that their loved ones had lost significant amounts of weight, lost their ability to walk, stand, and sit up, to eat and drink without full assistance, and in some cases, lost all independent skills completely. They found that their loved ones had become incontinent and developed pressure ulcers. Families were horrified by their loved ones' appearance. They observed that loved ones were dressed in dirty clothes and had not been bathed or had their teeth brushed with any regularity for months. They observed that their loved ones had unhealthy skin, unkempt hair, fingernails and toenails that had not been trimmed, and in one case, a loved one's nails were dirty, long, broken, and had jagged edges. Families also described how residents' mental status suffered. Many families said their loved ones had become depressed, felt abandoned, and in some instances, even suicidal. One daughter said, "Mom is despondent. She feels like she's in prison. She cries a lot and says she wishes she was dead." Many residents had withdrawn into themselves and stopped interacting at all. One family member wrote, "Complete disconnect from her surroundings and me, formerly a social butterfly and telling jokes, now nonverbal." And over again, we heard that residents with dementia and other cognitive impairments suffered precipitous declines, often becoming completely disengaged, unresponsive, and even losing their ability to speak. Tragically, this is just a sampling of the responses we received about the condition of residents as a result of the ban on visitation. One family member summed it up this way: "This is a trauma that cannot be undone. Removing essential caregiver access is deadly. My parents are already dying. We are not saving them from death, but preventing them from life." We cannot permit residents to suffer in this way ever again. Residents must be given a guaranteed right to access essential caregivers during public health emergencies, a right that cannot be waived, cannot be modified by federal or state government, and cannot be subject to facility discretion. Because even when CMS no longer completely banned visitors, revised CMS guidance created loopholes that were then used by nursing homes to restrict the length, frequency, and location of visits. These restrictions, for example, 30 to 45-minute visits only once or twice a week, have made it impossible for family members to assist residents who have declined or who experience extreme distress this year. The Essential Caregivers Act provides a common sense way to ensure that residents will remain safe during the next public health emergency without facing the isolation and neglect that caused so many to suffer and die during the COVID-19 pandemic. Thank you.